Thank you for coming today. We are going to be talking about those struggles that you might be having that are caused by or related to inflammation, like poor energy, brain fog, cravings, lack of sleep, all of those sorts of things, which can be related to inflammation in menopause. My name's Melanie White, and I'm the co-CEO of Sage Women's Health. And we are here to help women to manage the mess of menopause, to help women to figure out natural solutions to not just get rid of symptoms, but also enjoy a better quality of life and to feel healthier and to age healthily going into their older years. And I introduce today Amanda Mannes, our consulting dietitian. And I'm going to hand over to Amanda Mannes now to talk to you about inflammation and a little bit at the end about the Sage program that we're running, Tame Your Inflammation. There's no pressure to buy this program. We're just talking about it in the context of inflammation if you're interested. So I'm going to hand over to Amanda. Welcome.
Hi, everyone. Thank you for having me today, and thank you, Mel, for the kind introduction. Okay, so what we're going to talk about today. So we're going to talk about why we're here talking about this to start with, the importance of that hormonal balance and what we can do about it, and focusing on nutrition to control inflammation, because I'm a dietitian, so that's my jam. And it's really important, I suppose, in my own life. I found that connection very strong, and also in many of my clients' lives, that when we control our inflammation, then pretty much everything else within our body works better. So, and then we will touch on the program. If you do stay to the end of the webinar, and I might have to get Mel to help me with this, I've got a little bonus, so we can talk about that. If you're still here at the end, you will get that. So, okay. So why we're here talking about this one today. So basically, all women if you're over 40, you're probably noticing that the low energy, that it's easier to gain weight, the brain fog, maybe some bloating and gut issues. It is something that we all experience at least at one time or another. And it's not as though we can eliminate completely, but we can minimize it as much as possible. So if you're here now, you probably came because you're noticing things exactly like that, those few extra kilos around the middle, all of those things. And that they're happening more and they're happening faster because our hormones are changing. And the more our hormones are dysregulated, the more we'll experience these really uncomfortable and life-changing symptoms in our body. So if we're brain fogged and we're feeling really sluggish and we feel like we're just carrying all this extra stuff around, then that affects our ability to work and all these things. So we need to get that under control, to feel like ourselves again and to feel like we can do all these things really easy. And I started noticing this connection for me. I started noticing these hot flushes and the brain fog and the weight gain probably like I started in my early 40s. Like I'm not sure now. I'm 43 now, and I've been experiencing these, especially the hot flushes and waking up really drenched during the night for probably at least 3 years. And it happens when I'm inflamed, and it happens when I have flare-ups. I've got a few inflammatory conditions myself, and for me, that connection is super strong. And I've heard it from clients over and over again. They've said, like, I didn't know if I had the flu or I was getting a flare up and then I felt like I got the flu, or I was getting really sick. And I'm like, I think that's, your perimenopause symptoms starting to kick in there. So it's important to understand what's going on, and then we can do something about it. So the challenges. So I suppose we are going to be talking about these things in a little bit more detail. So we're going to talk about the challenges, why it's happening, and how we can balance that all out. So Mel's got a little poll for us. I want you to pick out your top 3 symptoms that you're experiencing. I don't know if I can do this too, Mel.
I've just launched the poll, so hopefully everyone can see that. One question, what are your most annoying symptoms? And you can list up to 3, and you should be able to just click on that poll. Yeah, okay, we're seeing some people. Exhaustion's a big one. We've got joint pain, bloating, sugar cravings, sinus problems.
So often we don't recognize those sinus problems could be related to our inflammation, and that inflammation kind of being amplified by changing hormones. Okay, a fair bit of bloating as well, the joint pain. So I'm just going to drop down 80/40. So tiredness and exhaustion is the main one. Yeah. Okay. I don't know if I can share these results with you now. Can you guys see them?
Yes, I can see them.
Oh, okay. So I'm going to stop sharing that one now. But it is, I suppose if I jump back to that, like a lot of people that I talk to, you know, there's symptoms that they're not connecting. So I know myself, once I went to the ED because I thought I was having a heart attack, and it was just a severe reflux and bloating. That it was pushing, you know, everything was being pushed up. I ended up in hospital a few days later with a bowel flare-up from my inflammatory bowel disease. But that was the symptom that I got first. It was an inflammatory reaction, thinking that I had a heart attack. And that is happening more and more with women in midlife. So the factors contributing to our inflammation. So as these hormones start to change, it affects the hormones because they're basically, if you think of them, they're basically transmitting signals from one thing to the next. So if there is inflammation, it's kind of just like clogging up the system. And things are happening delayed, or they're happening at the wrong time. And one hormone doesn't work in isolation. So if we throw one hormone out, that has a cascade effect. And whether it's directly from our menopause symptoms or everything that else is going on in our life. So we've got lots going on in our life. We're expected to be on more than ever at work and at home, and, you know, being the perfect, you know, doing all the things for the family, probably starting to look after older parents as well, juggling businesses, all of this stuff that can be, you know, you mightn't feel stressed, but because you're on the go all the time, that can raise our cortisol level. As soon as our cortisol level gets raised, that raises our insulin levels. When our insulin levels get raised, that affects our food, like we crave more sweet food. That then triggers other hormones. Then we start this really big inflammatory cycle. Every one of those things leads to more and more inflammation. So it's not one thing and we're done. It's kind of balancing all of these things together. There's, you know, it's once we do get really busy and stressed and inflamed, then we start to take more convenience foods and things that are easy, and we're not watching our diet so much because we are tired, exhausted, and inflamed. So then we start, you know, putting on that little bit of body fat around the middle. That produces more, you know, that actually creates more insulin resistance itself, and we're kind of going around and around in these loops. So we're trying to get not one thing sorted, but just that whole kind of balance, that whole thing. So it's not kind of do this one thing and you're done. It's kind of revisiting it over and over.
Thanks, Meta. I was just going to say, I notice particularly for myself when I'm really stressed, I tend to get those cravings and not sleep well and make those choices. I've really noticed that for myself over the past couple of years.
Yeah, it's really interesting, isn't it, Mel? Like, I know as soon as I don't sleep well, there is lots of evidence that you need your 7 hours, otherwise your insulin won't work as well as it should. For me, as soon as I get under that 7 hours, but I've honed it in a bit more, if I'm awake at a certain time of the night, I know I'm going to crave more carbs during the day. And these aren't good carbs that I'm craving. These are the ones that are going to make me feel pretty terrible. So, yeah, it'd be nice if we could just learn this once and be done with it. But it's about learning to implement these changes and implement them when we are tired, and also forgive ourselves when it's really hard and we just can't do it. Yeah. So where does that leave us? So I suppose, yeah, another little poll. Why would you guys like to lower your inflammation? What would be your main reason or reasons?
I've just launched that poll, so everyone here can vote about why they might like to lower inflammation. So I'll leave that open. You should be able to find the buttons to vote in that poll. It's quite a varied response this time coming up.
So let me know when you're done and I can end the poll and I can share it. Give you a few more seconds, but so far the joint pain is the leader. Okay, so let's get it in. So do we have yep. So, okay, so we'll end the poll there and I'll share those results. Hopefully you guys can see them now. Let me know if you can't. But yeah, it's really interesting. So a lot of people come into the clinic and say, or contact me and say that they want to lose weight. That's their main reason for being there. Often they're so excited about these other things that they feel better within their body. They don't have the aches and pains, that they're, clearer in the mind, their bowels are working better, maybe they're not having the hot flushes. So we talk about weight being this really important thing. And if we're carrying a few extra kilos, that's the one that springs to mind the most. But yeah, as you guys seen it, it's one of those factors that's important, but sometimes it's not necessarily the most important. So, and we can't control what that number is saying on the scale. We can only control what we're doing. The food we're putting in, the sleep we're getting, the exercise we're getting. They're the things that we can control.
What's interesting about this poll is that we've got 7 people who voted in it, and everyone's picked a different thing just about.
It is.
Except for the joint pain, 2 people have said that.
Yeah. Yeah. It's and it just shows you how inflammation affects people differently, and people have different priorities. We all want to improve our health and well-being. We all want to be better. It's just human nature. We want to do better than we're doing. But we all want to do that differently. And I think we need to recognize the individual in all of this as well. Okay. So what can we do? So we're here to figure out how we can, sorry, just change the slide. So how we can, improve our energy, reduce our brain fog, manage our weight better. So I want to talk about 3 main things today. So these are simple things that we can start doing today, straight from the webinar. First one is awareness. We can't change what we're not aware of. So finding some way to create awareness. If your priority was energy, it might be that you start to make a note of a number between 1 and 10 to measure your energy for the day. Because really, if you look back in a couple of weeks and your goal was to improve your energy, do you really remember what it was like? 3 or 4 weeks ago. I have no idea what my energy was like 3 or 4 weeks ago. So unless we're actually creating that awareness and measuring those really simple things that we want to change, it's really hard to see if they've actually changed. So those numbers on a calendar are really easy, something like that. If you want to change your diet, then I'd probably start to track what you're eating first, to really decide what is that one thing that's really causing the most issues for you. We can change everything about your diet, but it's probably not going to be sustainable. So what's the one thing that's going to make the most difference? And the one thing that comes to mind may not be the one thing that you can see after a week of tracking. You know, the most of our eating, at least 60% of our eating is on autopilot. Our shopping is autopilot. We buy the same things when we go to the supermarket. So unless we're actually gaining that awareness, these autopilot things are going to keep happening, and we may not be even conscious that they're the ones causing the problems. So just, yeah, think about for a minute, maybe, and maybe if you want to pop it in the chat box, what's one thing that you think you could gain more awareness? Is it your energy? Maybe it's your aches and pains, and maybe let us know how you're going to track that. Mel, maybe you can, if you can see any of those comments, maybe you can let us know what they are.
Yeah, there's nothing coming up yet, but what I can say is I think what I need to track is my sleep, and I need to track what I'm eating in the afternoon, because I know that that's like a Bermuda Triangle where food doesn't get counted, and I know that around the middle of the afternoon I tend to want to eat something sweet.
Yeah.
And perhaps I'm not really looking at that when I could be.
Yeah. Yeah, I can see some actually now. So Julie needs to track her sleep as well. And yeah, and over the last couple of nights, I was talking to Mel before I got on. So I think, guys, I need to start tracking it too. I've been doing different things and traveling a lot over these holidays. And I actually just worked out the other day, I've been at home for less than 7 days, and they're not consecutive, since probably mid-December. So sleep and yeah, those kind of normal patterns, getting back into normal routine. I'm just going to move something so I can see. Or Mel, do you want to, if you can see those comments? I can't see them.
Amanda said, track my mood with a daily rating.
Yeah, that's a really good one.
Julie said sleep. Jenny said, notice when my joints are more achy and my energy low.
Yeah,
I think the energy one's a good one too. Sleep from Michelle, and Julie has said, it's been a real eye-opener, as I can now see when I wake up at night, something's not right. So it sounds like Julie's made that link.
Yeah. Okay, well, we'll keep going. So the one change at a time. So by creating that awareness, we can focus on one thing. When we focus on too many things at once, it just gets too hard to manage, and we drop the ball. So although we do want everything to be really good and perfect, we want to be in this optimal health for as long as we can. If we do too much, and I do this, I'm shocking at this, I set my goals too high and something will happen and they come down again. Now, I've got these basic guidelines that I kind of set myself. We'll talk about that at the bonus at the end, but I know that I'm on track if I just do a couple of things every day. So for me, movement is really important to me. If I move, it doesn't matter how. It doesn't have to be vigorous exercise. If I'm doing some movement a day, like if I've done nothing, a couple of push-ups will be done and I can tick the daily movement box. So those things, creating these really big goals sometimes doesn't help. It's the small ones. And if you want to create a few small ones. Don't, if you want to work on something big, it's one big thing at a time. So I suppose I'm going to pop it back to the chat box and go, well, what would be your one bigger thing that you want to work on right now? And if it's something like your food, exactly what part of your diet are you thinking about? Is it cutting out some of the processed food, the treats? Is it, a smaller meal at night? Is it, what is it for you? Everyone's different. It's reducing, that extra alcoholic drink, all of what resonates with you at the moment. So Mel wants to lower her fat and increase her omega-3s, which are great anti-inflammatory strategies. Amanda wants to eat more veggies at breakfast. I want to get my fruit and veggies on track again because they haven't been as high as usual with all my travel, and I can feel it in my joints. Cutting out alcohol. The screen's over part of it, so
that says cutting out alcohol has helped evening energy enormously and sleeping so much better.
Exactly. Yeah. Awesome. Okay. And so we talked about getting some awareness and tracking it somehow, keeping it in front of your mind somehow, choosing your change, and sticking with that one change. And then we kind of think about, well, yeah, all our chronic inflammation stuff and how we can do that. So there's lots of ways to reduce our inflammation. The basics of it are increasing your fruit and veg, cutting out the processed food, reducing or eliminating the alcohol, increasing the omega-3s. So much. There's supplements and things like turmeric and black pepper, and the list goes on and on. So it's the big ones that will count the most. The cutting out the processed food, and increasing the fruit and veg. Okay, so why do we do all this? So basically, we do all this so that we feel better within our body. So our hormones will work better. It's, those systems won't get clogged. If we keep our cortisol and our insulin under control, then our weight is easier to control. If we're eating well and we're, that link between the alcohol and the sleep that was just mentioned in the comments before, if food can either give us lots of energy. If you eat a beautiful salad or have a veggie juice or something and you feel vitalized straight away, you can feel that in your body. Just like if you eat too much chocolate, all of a sudden, you might feel great for 5 minutes and then you start to crash and you want more chocolate, and you start on that cycle where you keep popping back to the fridge to get another row. So that, all of those things, they contribute, all of that, the sleep, the food, all that contributes to our gut microbiome. And there's so much links between our gut and our thinking. Our thinking is actually controlled by our hormones. So it's all connected. So when all this works really well together, then we have less symptoms. We have less brain fog. We have less guts, the bloating. We have less aches and pains. We have more energy. We have less waking up in the middle of the night covered in wet sheets. We've got all of those things work a lot better. And if those are working better, then we can think more clearly, we can work better. We have, more patience, better relationships. If we're not full of aches and pains, we're just more tolerant of people and can get more done. So, it's not just about, it can mean so much more than that. So I suppose this is a good time to ask, what what else do you think would improve in your life if you were able to improve your inflammatory levels?
I've just started the ball rolling, Amanda said my mood. I really noticed that when I have even like 2 alcoholic drinks, the next morning I feel flat, I feel agitated, I might be more anxious, feel withdrawn, but definitely also my tolerance for junk food and sugar and stuff has gone down, and I have that same sort of stuff as well. And we've seen Michelle said energy, Julie said less reactive to people or situations, Jenny said energy.
Yeah. So
Amanda said energy as well. Interesting that energy comes up.
That's huge. It really is. For me, it means that I'm a better mum. For me, as soon as my inflammatory levels go up, I can't think straight. I am, achy, and I don't have any patience. And so that means that I don't want to talk to anyone. And, my kids, especially in the school holidays, they talk a lot actually. So it can be challenging. Yeah. And they know, I don't know if my son recognizes it, but my daughter recognizes it straight away when I'm inflamed. And yeah, it's a bit sad that she knows when she has to be mindful because mummy's a bit flared up at the moment. But yes, it does. It impacts everything. So they're the reminders when those things are with, when I'm less patient. That's a pretty clear reminder that the next, opportunity I get, whether I often say, okay, tomorrow, like I'm going to refresh again tomorrow. I'm going to pull out my trackers and I'm going to do my stuff and pull myself back into line. So I think if you're noticing those things like that, if you want to improve your energy, if you're noticing it low, that's when you need to get really diligent for a little while. There's another comment.
Amanda's just popped in. That's the reality. We don't live in a bubble where everything's perfect. And I think it's interesting that when you're not paying attention to those things, they're happening in the background. And even though you know it, you're not really attentive to it. So you can be bumbling along through the week, feeling tired, being cranky at meetings. I know I just don't want to talk to people when I'm eating the wrong things and doing the wrong things. And I think, well, what's the cost of that?
That's massive. Yeah. Okay, so hopefully you've got some ideas to take away and maybe think about 1 or 2 more things just a little bit more than you have been. I wanted to introduce our Tame Your Inflammation program. So this is aimed at women over 40 because we are hoping that we can, well, I see it every day, that reducing your inflammation improves your hormonal balance, it improves your energy, it improves, those aches and pains, it improves the bloating, and it just makes you feel better within yourself. So this program is, it's not a quick fix. It's about teaching you, about inflammation and what it does and how it's doing it, but it also teaches you about habits, resetting, kind of what to track, how to meal plan. There's a lot squeezed in 4 weeks. The education components, aren't that big. So I've done this whole resource book that goes with it because we can't do all this at once. So it's there for you to go back to at any time. But I think the magic of this program is that we've got the group coaching sessions, and how these group coaching sessions work is we're broken into small groups, and I actually talk to everyone individually on the calls, and we work about what's going on for them now, what's the next thing they need to do, what do they want to do, how they're going to go, what's stopping them from doing it, and what's the next step. Just that basic coaching to get them to keep making progress through that 4 weeks. It doesn't matter where you are. it doesn't matter what challenges you're facing. It's about moving you forward from where you're at now. And that framework of that small group coaching one-on-one, I've done that. I did that for about 3 years with a small group of women, and they kept kind of signing up one after the other. And it's about that support, that community. And it's about, there's no judgment. Everyone, it's an opportunity to see that everyone's actually dealing with the same stuff. We look at other people and go, oh, they've got everything together. In reality, they probably don't. They just kind of, we see the best in others and we see the worst in ourselves. So it's about kind of normalizing and kind of showing you that there is a way for you to move forward. You don't have to be stuck where you are. There's always an easier possibly way to do it than you've blown it up in your brain. I'm an overthinker, so I can overthink everything, and coaching just kind of moves you through that. So we've got our education sessions each week, which will be recorded if you can't get there. We've got our coaching each week, and there are meal plans and shopping lists. These are generic. They're supposed to be a guide. You can follow them to the T if you are that way inclined, but most of us will pick out and choose, and there'll be some other meal planning, how to do it really quick when you're really busy and really run down. There's juice bonuses, there's supplement handouts. There's all sorts of wonderful bonuses in there. So if you do have any questions, let me know. Otherwise, this is what we're going through each week. So we start the program with a reset. It is a detox. We want you to get results through the program because, managing inflammation is a lifelong thing, to be honest. So if we can put some really targeted energy into the first 3 or 4 days, then we can actually clear out a lot of inflammation in the body, and you'll start to feel that energy come up, and hopefully it will make the next couple of weeks easier. So you don't have to wait to the end of the program to get your wins, but we talk about understanding and mastering those hormones, how to fit things in this busy, chaotic life that we all lead, and how to create habits. There is the optional biomarker monitoring as well, so that there's an objective measurement that you can see, that you can, see if there's been changes in your inflammatory markers or your heart health markers as well. And Mel will talk a little bit more about that. There's just some quick examples of some of the stuff that's in there. And Mel, so I'm going to link to the bonus, but do you want to talk about the biomarking monitoring now before we go through the bonus?
Yes.
And that's the link there if anyone wants to copy and paste that, or if they want to join while you're talking about that.
Actually, what I might do, I'm going to pop the link in our chat box here this is for your Practice Better link.
Mm-hmm.
Just going to pop this in the chat box for people who are interested in the program.
So that link there takes us straight to my practice management system and jumps you straight into the landing page. So it doesn't have much detail on it. So that's to sign straight in. The web page I've got up here, www.sagewomenshealth.com/tame your menopause. That one will tell you a little bit more about the program as well. So either or.
Thanks, Amanda. Actually, while I'm going to share my screen now to talk a bit about the biomarker biomonitoring, and I'm presenting this on behalf of Trajan Health. Their Trajan Health's Monitor You service gives easy, informative and actionable health monitoring by measuring some key biomarkers in your body. And that means that you as an individual can track the impact of diet and lifestyle changes on health and overall wellbeing improvements. So I'm just going to quickly talk about how the monitoring works. We're using their Healthy Heart panel because that's really relevant to what Amanda's doing in her program, and it includes the measurement of 6 key biomarkers, which you can see here. The HbA1c is a biomarker of diabetes. We're particularly interested in the HSCRP and the EPA ratio, which are markers of inflammation. We're looking at triglycerides, which is a type of fat found in your blood that increases your risk of heart disease. We've got an omega-3 index that measures the dietary intake of omega-3 through foods like fatty fish and flaxseed. And those foods have a really crucial role in helping to keep heart and blood vessels healthy and your immune system working normally. So that's really relevant in this case. That middle one I mentioned a moment ago in conjunction with a C-reactive protein, that's arachidonic acid, AA to EPA. So it's inflammatory versus anti-inflammatory fats, basically. And then there's a trans fat index, which is a special type of saturated fatty acid, which is unhealthy, and it's often found in baked goods like pastries and things. So we're also measuring how that changes over time too. And you can prevent heart disease, diabetes, and chronic inflammation with some simple diet and lifestyle changes, or you can better manage those conditions. And by knowing how your choices are impacting your heart, you can make those changes, for example, through Amanda's program. And so going back to what Amanda was talking about earlier with tracking, this is one way that you can track the effectiveness of what you're doing, and it's an evidence-based way. How this blood monitoring works, if you choose to do this, so you can do the program without this component, but if you'd like to do this, you would get sent a kit. So you basically sign up through a link that we provide you and order a monitoring kit online, and that's delivered to your door. The kit contains written instructions on how to prick your finger to take a blood sample, and you put it into a replied paid envelope and send it back. And when your results are ready, you'll be notified by email and you can access those results. They're presented in an easy to understand dashboard and tells you whether you're in the optimum range or not. And then, of course, you will follow the program that Amanda's doing. And at the end, you do a second kit. So you'll be posted out a second kit about 8 weeks after the first one. So you can monitor the changes that you've experienced over the period. So ideally, if you're going to take up the option of doing biomonitoring, you would want to take that sample before you start launching into Amanda's program. So we would recommend that you register for the kit in the next few days. And just to tie back to menopause and the link with biomarkers and heart health, there is a big link between menopause and inflammation, as we've discussed. And menopausal women may be at greater risk of heart disease because estrogen levels drop during menopause, and estrogen reduces inflammation. So when estrogen drops, fat might accumulate in your arteries and make them narrower, and that raises your risk of heart disease. And during menopause, you might experience weight gain, blood pressure changes. Amanda mentioned cravings, so that's blood sugar changes. And we want to manage all of those things because they're all related to heart disease and health. And the Monitor You service can help you to understand how what you're doing is making those changes. And one other thing I want to mention before we finish with these slides and go to questions. Trajan Health is committed to privacy and quality, and that's why we are partnering with them, because they're a NATA accredited lab. So that's one of the gold standards in Australia for laboratory testing. The results are private. They're shared with you. And if you choose to share them with Amanda, you can. You take the sample in the privacy of your own home. You have a dedicated password protected login. So the results aren't shared with anyone unless you choose to. And the lab is in Melbourne. So I just wanted to give you some background on Trajan Health and why we've partnered with them, and the fact that your data is secure, confidential, and private. So I'm just going to stop sharing and hand back to Amanda for Q&A.
So while we're waiting for some questions to come through,
I can see Tracy's popped one in the chat box.
Oh, yes. So Tracy asked if I've got a provider number. So I do have a provider number. Some health funds do provide rebates for group education sessions. So it's up to talking to your individual health insurance and see what they will cover. A lot of them are only covering individual consults, so that wouldn't be included. But there's more and more covering kind of health coaching programs as well. So just, we are doing coaching as part of a component, and there's the education component as well. So depends on your private health insurance, really. That might be an option. Is there any other questions?
Nothing coming up in the chat box. I guess to clarify, we wanted to say that you're starting on Monday, the 5th of February.
Yeah. So if you're keen to do the biomonitoring, those as Mel said, those kits need to go out. So those registrations, if you can get them in early, it's time for that company to get that information delivered to your door.
Amanda's asked, can you talk a bit about the first 3 days of detox? What's involved? It sounds interesting.
Yeah. So there is a shopping list and a meal plan to support that. Basically, we're looking at reducing everything in the diet, completely eliminating anything that causes an inflammatory response, and just including foods and beverages that promote reducing your inflammation. So we're just bombarding the body with good, healthy fruit and veg that will get our inflammatory markers. We can actually, it's really interesting. So it's just 3 days. We no processed food, no red meat. We're getting it up. Our fruit and veggies super, super high, and we can actually feel. I've been doing this with clients for probably about 5 years now. I just started as a bit of an experiment after reading some studies about different things, and I didn't tell my clients what was going on. So I did it myself, and I got 2 clients as well to start on the same day. And we did it for 3 days without much instruction. I just gave them some simple instructions about increasing their fruit and veg, mainly their veg, as high as they possibly could, and getting your water up. And we all noticed that we were starting to get really thirsty, that we were peeing all the time, all of these things. And you could actually feel, it's a very strange feeling, you can feel the inflammation start to leave your body and that energy coming up. So there is a guideline, the guidelines there, how to do it to get enough in. But if for those that aren't joining the program to get those specifics, it's really about getting your veggies really high for a couple of days and eliminating that that stuff that clogs us up, that increases our inflammation in our system. Hopefully that's been helpful. That answers that question.
Thanks, Amanda. I've just put, if anyone has questions about the program or otherwise, they can email info@sagewomenshealth.com and we'll pass the query on to Amanda. And Tracy said, can you have coffee?
Yeah. So in the 3 days, you can have black coffee in the 3 days. Can't have your milk, sorry. But black tea and coffee are allowed. So I'm just going to, I am screen sharing. So I've just, so for those that are still here, if you could pop your email in the chat box if you would like this, and I can get that sent to you. So this is a little bonus just for being here. So this is something that I've done up for the last 3 or 4 years for my clients, and it's just a health and wellness tracker. So you've got a little some worksheets about your strengths and your values, and setting words and intentions for the year, and brain dumping your goals and all of these wonderful things. But this is where the magic is. So you've got a little planner for the month, if things that you're focusing on, and just, you know, really taking it back to those couple of things that you're working on each month. But I got my son to color this in to show you how it works this morning. So this is, so you can just write down your very simple things about what you're working on. Each of these things there's enough circles in each month that correspond with the days of the month. So like February has less, you know, the 31 will have 30 days or 31. And it's a bit of a mindful activity. Sometimes people, you know, like things to look pretty with their trackers. So it's, you know, you can color it in, make it as pretty as you like. And sometimes just having a nice resource that you keep all your stuff together makes you feel good and makes you want to do it. So, you know, you can print that out, get it bound, whatever you like. You know, it works really well. You can see that this, he did this on the iPad this morning. So I wrote those things in there for him, very simple. And then, you know, my little rule with my clients is you don't put crosses. If you don't do it, just do it a different color or leave it blank or something. Don't, you know, be nasty to yourself. Make it a positive, special place to track.
I love that. It looks beautiful.
Yeah. So, so if you would like a copy of this, obviously without the little, you know, painting or drawing all over it, if you would like a fresh copy of that, then just drop your email and I'll get that sent off this afternoon.
Great, thanks. And also, if you don't want to share your email with anyone else, you can pop it in a private message to Amanda now, or you can email us at info@sagewomenshealth.com.
Oh.
Thanks everyone for coming today. It's been great to see you all here. I know a lot of you are interested in lowering inflammation and managing your health or various aspects. And as we saw, there are a lot of different symptoms that people are dealing with and different reasons why people might want to lower inflammation. But I think it's really important that when you're at this age, you're making choices that are going to affect the rest of your life. I think that's quite significant. It's not just about doing something for a bit of fun or to try something. It's actually a serious thing that's going to affect your health and your health risks going forward. So I love that Amanda's put this program together to help not make you follow a rigid structure, but just to give you some tools and ideas and principles to make some really sensible changes to the way you eat so that you can lower inflammation. And if you are interested, when do the doors close for this program, Amanda, if people want to register? It's by Sunday night, I think, isn't it?
Yeah. So look, if they can register, so it will actually keep registrations open till the Saturday, I think, before the program starts, so about the 3rd of February. But the biomarker monitoring will, like, unfortunately, that closes. Yeah,
Sunday night.
Friday or Saturday.
Yeah, just to get the kits in time to everybody before the start of the programming, we need to allow postage time if you want to do that option.
Exactly.
Yeah.
Okay. Any last minute questions?
Thanks everyone for coming. Thanks, Amanda, for hosting us today and sharing that information. It was great to see you. And yeah, we'll be in touch with everyone soon. Have a fantastic week. If you have any questions, there's a few days till we start the program. Feel free to get in touch. And if you know someone that might value knowing this information about inflammation and how to reduce it, feel free to pass our details on to them too. All right. Thanks, everyone. We'll see you soon.